Hi, I'm Sean Fontaine. I'm a sleep scientist. Today we're talking about how common insomnia really is. Why do different studies give different numbers? And how can you identify and start trying to fix your own sleep problems? Let's start with the first question. How many people have insomnia worldwide? The answer is it's complicated. Some studies say 1 in 10, others say 1 in 6, and some even go as high as 1 in 3. Now, the reason for this difference is that insomnia, the word, actually refers to 3 different levels. Level 1, insomnia as a symptom, refers to occasional bad sleep. Level 2, insomnia as a pattern, refers to a stretch of bad sleep that starts to affect your daytime as well. Level 3, and this is the most serious, is insomnia as a disorder, also known as chronic insomnia. Now, despite all sharing the same insomnia name, these are actually 3 completely different problems. And so the level that you're dealing with massively affects the best way you should go about seeking treatment. In this video, I'm going to cover all 3, as well as what you can do in each level to again return to restorative sleep. Let's first talk about level 1, insomnia as a symptom. This happens when, at least some of the time, you have trouble falling asleep, trouble staying asleep, or trouble waking up too early and then being unable to fall asleep again. This is very common, and we know from research that at least 1 in 3 adults, that's over 1.5 billion people, experience some of these symptoms at least some of the time. Maybe you had coffee too late, maybe you traveled, maybe you're stressed because of a deadline, or maybe it was just a random 3 a.m. wake up. All of these are totally fine, and pretty much everyone will experience this at least at some point. The good news is, as long as you stay calm and don't change anything, you should eventually be able to fall back into your regular sleep routine, as if it never happened. And when I'm working with people that are going through this, I really emphasize the don't change anything message. The reason for this is that overcorrecting and making a bunch of changes to your sleep schedule, number 1, will not work, and number 2, will actually make things worse. Let me explain. When people get a bad night's sleep, often an instinct is to try to catch up on sleep. Maybe sleeping earlier, maybe taking a long nap, maybe waking up later. Now, while this will get you sleep in the moment, a consequence is that you will probably spend the next night lying awake in bed. Then you'll get bad sleep, and then the cycle will kick off again. So don't turn one bad night into a pattern. My advice is actually to continue your day as normal, and then when bedtime approaches, you're probably tired already, and you should be able to sleep just fine. It's important also not to stress or get too frustrated, especially when lying in bed. Sleep, as we know, is a passive physiological process and simply cannot happen if you are actively stressing about sleep or doing something else like constantly checking if you're still awake. In fact, the less you hyperfixate on sleep, the better you will be able to sleep. In other words, sleep happens best when you don't try. That's why some people might read a book or listen to some familiar audio before going to bed, perhaps in part to take their mind off of stressors or even the topic of sleep itself. There are other techniques to help start sleep onset, including breath observation, which we talk about more in our short-term insomnia video. Really, there are many things you can do, but if what you're dealing with is insomnia as a symptom, as long as you don't stress and don't change anything massively, you should be able to eventually fall back to regular good sleep once again. Next, let's talk about level 2, insomnia as a pattern. This is more serious. Your sleep problem is now happening repeatedly, maybe over a few days, maybe over a couple weeks, and its effects are starting to affect your days. You may feel more tired, more foggy, more irritable, less focused, and less generally able to function. This is also quite common and affects around 1 in 6 adults. Importantly, at this level, the question to ask changes. It's no longer just how can I sleep better tonight, but additionally, what is driving this pattern of sleeplessness? The good news from a treatment perspective is that most recurrent sleep problems can actually be boiled down into 1 or 2 what I call pressure points. These are specific parts of your sleep routine that can impair your sleep over time. Once you identify and address your pressure points, recovery then becomes a lot easier. But where do you find your pressure points? Where do you even start? That's what I'm going to show you right now. My proposition is a 7-day sleep experiment, with yourself as both the experimenter and the object of study. During these 7 days, you'll first pick one pressure point. You'll then make a small change to your sleep routine that you think addresses it. And finally, you'll monitor results and check if anything changes. Here are some common examples you can try. Maybe you suspect that your pressure point is sleep timing. So, for 7 days, keep your wake time stable. Don't vary it by more than about 30 to 60 minutes between days if you can help it. Also, don't go to bed until you feel sleepy. If that means it's past your bedtime and you still feel awake, you can stay up. On the other hand, if you feel sleepy earlier, then you can sleep earlier. But keep your wake time anchored. Maybe you suspect that your pressure point is caffeine or alcohol consumption. So, for 7 days, try no caffeine whatsoever after lunch. And also don't consume alcohol in the evenings. A note on this from research is that while alcohol might make you feel sleepy initially, it's also been shown to reduce sleep quality. So try experimenting without this if this has been part of your regular sleep routine. Maybe, as a final example, you suspect that your pressure point is your bedroom environment. So, for 7 days, try to make your room as dark, cool, calm, boring, and predictable as possible. You can use an eye mask, earplugs, a fan, or even calm sleep audio. You can also try charging your phone further away from your bed if you're in the habit of checking your phone at night. I could go on with these, but the main idea is to pick a single pressure point, make a small directed change, and then monitor results for 7 days. The question you want to ask at the end of this is, did anything change? If the answer is yes in a positive way, great. You may have found your pressure point and now have an excellent base from which to start addressing your sleep problem directly. However, if nothing changes, you can consider trying another pressure point, and finally, especially if your sleep remains consistently poor, or if you suspect your poor sleep is as a result of a more serious condition, please consider getting evaluated by a clinician. Let's now talk about level 3, also the most serious, chronic insomnia. Definitionally, this means that your sleep problem has been recurring at a rate of 3 or more nights per week over a period of now 3 or more months with real daytime impairment. Now, while not as prevalent as the other two forms of insomnia, this is still a big problem affecting around 1 in 10 adults worldwide. That's over 500 million people. Now, the key thing about chronic insomnia is that due to its complexity and how ingrained it is not an issue that most people can fix on their own. At this point, attempts to fix sleep hygiene will likely be ineffective. Other solutions, such as self-medicating through over-the-counter sleep medication, are both dangerous and could make things worse. The best path forward, if you are able, is to work with your family doctor, sleep clinic, or other qualified medical professional. We have a full video on chronic insomnia and the best way to get treatment linked above. But to quickly summarize, working under professional guidance can give you access to specialized treatments, most commonly cognitive behavioral therapy for insomnia, abbreviated as CBTI. This can help you regain control over things like sleep scheduling, stimulus control, reestablishing the bed in your mind as a cue for sleep, and changing your own sleep-related thoughts. A medical professional may also prescribe you appropriate sleep medication. Finally, a medical professional can screen you for other conditions that might be silently keeping you awake. For example, chronic pain, sleep apnea, depression, restless leg syndrome, or maybe even a circadian rhythm problem. So if you have chronic insomnia and you are able, the best path forward is to see a medical professional. By seeking the appropriate help and following through with recommendations, the vast majority of people can again fully recover and return to restorative sleep. So back to our original question of how common insomnia really is, some studies will say 1 in 10, others will say 1 in 3, and all are technically correct depending on the level of insomnia they're describing. The big takeaway is that all levels are actually quite common, and that there are good, effective treatments for each level for you to recover. If your insomnia is just 1 or 2 bad nights, stay steady, don't panic, and you should be fine as long as you don't overcorrect. If your insomnia is instead a recurring pattern, try to pick a pressure point, test it for 7 days, and you may be able to stumble across a solution on your own. If, however, your insomnia is chronic, please seek professional help, and working under professional guidance, you should be able to get the structured help that you need. Hi, I'm Sean Fontaine. I'm a sleep scientist. Thank you for watching our video, and I hope it was useful. If it was, please like, comment, and subscribe. And wishing you a very good night's sleep.